Yes, you're welcome to my channel. This is your boy Jacob. Now, today we are going to look at the Ugandan health system in details. Now, our system depends on a referral system where our patients are referred from the lower levels up to the national referral hospitals. Now, the Ugandan health system is divided in two parts, the public sector and the private sector. And today we are going to look at all these sectors in detail. So if you are new to this channel of mine, just consider subscribing to my channel by clicking on that button right in the corner. Click a thumbs up if you enjoy my tutorial, and don't hesitate to make a comment right there in the comment section. Now, today we are going to start with the public sector. Now, the public sector has four categories of hospitals: the national referrals, the regional referrals, the general referral hospitals, and the health sub-district hospitals. Those are health centers below 1, 2, 3, and 4. So we are going to explain all of these in details and which level of services which are provided in each of these facilities. Now we are going to start with the health sub-districts where there are health centers. Now in our health sub-district, the lowest health center which everyone starts with is the health center 1. Most of people don't know health center 1, but that is the lowest level of health services which are provided in Uganda. Now, in Health Center 1, we have the VHT. VHT are basically volunteer. They deal with just helping out health workers in many things. They don't have that much qualifications apart from attending health education, and CM is where they get a few papers which shows that they are VHTs. So basically, VHTs help with dispensing of common drug. They help during immunization. They help during health educations. Basically, they get a few payments from PHC funds which are hospitals give them. So basically, that is the lowest center of health service provision in Uganda. Then following that, we have a health center 2. Now, a health center 2 is the one which has a structure. VHTs don't have a physical structure, but health center 2 have the structure, and they are at the level of a village. Now, health center 2s basically are managed by an enrolled nurse. That is the lowest manager at the health center 2, with other 3 nurses, the midwife, and 2 health nursing assistants. Those are the managers, the four health workers who are supposed to work at the health center 2. So basically, health center 2 provides outpatient clinics, basically outpatient services. They deal with walk-in clients. Then they also provide antenatal services. On top of that, they provide immunization and health education, plus a few family planning methods which are provided by most of the workers. Apart from the 4 health workers, they have also a porter and a nurse carry. Basically, they have a total of around 6 staff who work at that health center 2. Now, health center 2, the thing they don't do is they don't carry out deliveries. They also don't do admissions. They just do outpatient basically. So if you want more about the management and services provided by Health Center 2 in Uganda, just click on my card up here. Then followed by a Health Center 2, there's what we call a Health Center 3. Now, a Health Center 3 has staffs twice what a Health Center 2 has. It has a total of around 18 staffs, and the overall manager of a health center is just a clinical officer. Some centers put in registered nurses, but basically it's clinical officers who manage health center 3s. Now, health center 3s provide more services than a health center 2. On top of what a health center 2 does, they have a maternity center which is quite very busy. They do deliveries and they provide more services to the people than what a health center 2 does. So a health center 3 basically is on a sub-county level. They provide more services to people and they handle more people than what a health center 2 does. So if you want more details on services and management of health center 3, I'll put a card up here where I've explained the details on each and every service which is provided by a health center 3 in Uganda. Yeah, so after health center 3, we have what we call a health center 4. Now, a health center 4 is at a county level and it is managed by a medical officer. It provides more services to more people, like on top of what a health center 3 has. A health center 4 has inpatient for both men and women. They do admissions. On top of that, they have a theater which a health center 3 doesn't have. So they do operations, and that's why there's a medical officer there as the overall manager. In case of NSC section, he's the one to do them. Now they have a bigger number of staff also compared to what a health center 3 provides. They have many clinical officers, nurses, midwives, records assistant, very many staffs compared to what a health center 3 provides. So if you want a full tutorial on the services provided by a health center 4, I'm going to put a card up here which has all the services and the management of a health center 4 here in Uganda. Now, after a health center 4 at the district level, we have what we call the general hospitals. So a general hospital provides more services than a health center 4. And they have more medical officers who manage more patients than what a health center 4 does. Because a general hospital is at the district level, it provides services to all the people in the district. So it has more clinics. They have eye clinics, psychiatric clinics, dental clinics. They do imaging. They have labs. They have more clinics than what a health center 4 provides. Also, the number of staff is almost twice what a health center 4 provides. So it's the next level of a facility at a district level. So after a general hospital, we have another bigger hospital known as a regional referral hospitals. Now, regional referral hospitals, the difference between regional referral hospitals and general hospitals is the specialists. Yeah, basically specialists. On a regional referral hospital, you find more specialists than a general hospital. You'll find obstetricians, surgeons, pediatricians. So all the consultation of services is more at a regional referral hospital than a general hospital. So all patients who cannot be done at a general hospital, they are referred to a regional referral hospital. Now in Uganda, almost each district has a regional referral hospital. There's Arua Regional Referral Hospital, there's Gulu, there's Soroti, there's Lira, there's Mbale, there's Jinja. Almost each district in Uganda has a regional referral hospital. That's especially the big districts. All of them have regional referral hospitals. So all patients who cannot be managed at a general hospital and they need that specialized kind of care, they are referred to a regional referral hospital. So the last level in a public sector of referral is a national referral hospital. Now, most people, when it comes to national referral hospital, they think it's only Mulago. No, we have 5 national referral hospitals in Uganda. We have Mulago, we have Kawempe, we have Chirudu, we have Naguru, and Butabika. Those are 5. It's not only one. Most people, they think it's only one. No, it's now 5 national referral hospitals which we have in Uganda, and those are the maximum. You find more specialists each and every conditions. Now they are specific. If it's obstetrics, you go to Kawempe. If it needs a physician, you go to Chirudu. If it's a psychiatric condition, you go to Butabika. So nowadays they are more specialized than just a general hospital like how Mulago has been. So those are the 4 categories of health service provision we have in Uganda. It moves from a health sub-district down to health center 1 VHT level up to the national referral hospital. From health center 1 to health center 2, health center 3, health center 4, general hospital, referral hospital, and the national referral hospital. Those are the sectors of service provision we have in a public sector here in Uganda. Another section we have here in Uganda is the private sector. In the private sector, we have basically 2 categories: private for profit and private not for profit. So in private not-for-profit, basically these are missionary hospitals. Their aim of service provision is basically not to get profit. Yes, that is self-explanatory. So their aim of service provision is to care more about the patient than getting income from the patient. That's the difference with the private for-profit hospitals. So when they say private not-for-profit, basically these are church-funded hospitals like Mengo, Zambia, Ruvaga, all those church-based hospitals. They are the ones which have that type of management. So their aim is to serve more of the patient, to give the patient more than to get a profit from them. And they are basically church-bound hospitals. They are the type of hospitals which have that kind of care. So in most of these hospitals, they provide services more at a low cost than private for-profit hospitals. So in private for-profit hospitals, we have private hospitals. These include hospitals like CARES, hospitals like IHK, hospitals like Nakasero. Those are private for-profit hospitals. They are not church-bound. You go there, you want a good service, you need to give in your money. But also when it comes to private for profit, it goes down up to the clinic. When you open your clinic, it's private for profit unless it's charge bound. When you open your health center, it's private for profit. So all those privately owned hospitals and health facilities fall under that category. So those are the levels of service provision here in Uganda. So you need to see where you fall. Yeah, so thank you very much for tuning in. If you have anything you want to comment on this tutorial, don't hesitate to make a comment right there in the comment section.